When you're homeless on the street and you've fallen all the way down to that point where you're sleeping in a tent on the street, smoking or injecting fentanyl every 2 hours just to survive, I think at that point, we as a community need to step in and say enough, for the sake of our own community, not just to save that person's life, but to save our entire community. Because right now, San Francisco is really falling apart.
In the last few years, the affluent Californian city of San Francisco has quietly been inundated by a fentanyl crisis. The highly addictive and cheap synthetic opioid has been seeping into the streets of the coastal city, creating a homelessness and drug-dependent epidemic beyond anything the city's seen before. Since 2016, overdoses involving fentanyl in the US have spiked by 279%. From 2019 to 2020 alone, the rate of deaths involving the opioid rose by 55%. Nowadays, the problem is only getting worse. If you live in San Francisco, you've seen the problem firsthand. For Tom Wolfe, he lived it. Now an advocate for homelessness and addiction awareness, only 5 or 6 years ago, he lived on the streets of San Francisco with a crippling addiction to heroin.
It's pretty unbelievable right now. You have somewhere between 4,000 and 8,000 people that are homeless on the streets, sleeping rough in San Francisco, and almost all of them right now are addicted to fentanyl. It has completely taken over San Francisco, and that in a 6-month period from May to November of this year, the police seized 76 kilograms of fentanyl off our streets, and that's probably about 10% of what's out there. And it's just created this chaotic, almost apocalyptic scene in several different neighborhoods in San Francisco.
While the drug fentanyl is used medically to treat patients with severe pain, there is also an illicit version. It is usually manufactured overseas, primarily in China, where it is then smuggled into the US, usually through Mexico, and sold on the illegal drug market. Making its way around San Francisco, it is not far from reach. The majority of overdoses, drug abuse and dealing takes place right in the city's downtown area. The suburb of Tenderloin bears the brunt of the fentanyl crisis, which sits right near Market Street, a major thoroughfare in the city. Only 1.5 miles from Tenderloin is San Francisco's financial district, where over 220,000 people work. San Francisco is the world's third wealthiest city, showing the clear disparity between the growing drug scene and the city's affluent citizens.
So San Francisco has a public health department. That public health department has a $2.2 billion annual budget. They spend $600 million of that on behavioral health services, yet we only have 500 drug treatment beds. That's insane to me. When you think about how we have 8,000 people that are sleeping rough right now, struggling with fentanyl addiction, and we only have 500 drug treatment beds, and it takes 10 days to a month to get into drug treatment. So if you're ready to go on the street to actually start your process of recovery, there's really nowhere for you to go, or if there is somewhere for you to go, it takes 10 days for you to access it. So for those next 10 days, you're back on the street using fentanyl, playing Russian roulette with your life.
In 2021, 70,000 people in the US died of drug overdoses that involved fentanyl. Now, 2/3 of all drug overdoses involve the opioid. In the last 10 years, fentanyl has largely replaced heroin as the opioid of choice because of how cheap and potent it is. In fact, fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. The strength of the drug is evident by the fact that in 2022, 200 people were dying every single day from the opioid. To put it simply, the rise of fentanyl has changed the drug game.
So if you go back a few years to 2018, when I was on the street, I think that year we lost 180 people to drug overdose in the whole city, which is terrible. But this year we're on pace to lose 800 people to drug overdose. And there's no more heroin on the street in San Francisco. It has been completely replaced with fentanyl. Fentanyl has contaminated other street drugs like crystal methamphetamine and cocaine. Now, 8 out of 10 times, those drugs have fentanyl in them. And it's just created this situation where you have a bunch of people that were using heroin switch to fentanyl. A bunch of them died. And then you have a lot of unsuspecting people that were using other drugs that are getting addicted to fentanyl unknowingly. And so they've really created this cash cow, which is why you've seen the amount of dealers explode since 2018 from maybe about 400 on the street to 800 to 1,000 now.
The epidemic of fentanyl use in San Francisco largely exploded in 2020 during the COVID pandemic. Since then, 80% of accidental overdoses reported have been fentanyl-related. 2020 was the deadliest year on record for accidental overdoses after 720 people died. In 2021, the city saw 640 deaths. In 2022, it rose to 647. As of this month, 2023 has seen 692 accidental overdoses, and there is concern that number could skyrocket above the 2020 record. To put it into perspective of how fentanyl is steering the drug scene, in July this year, 71 people died from overdoses in San Francisco. 62 of those were fentanyl related. It is a different city to when Tom Wolfe lived on the streets in 2018.
It's night and day, really. So, back then we had, about 3,000 people total that were homeless in San Francisco. Now there's somewhere between 8 and 20,000 people homeless in San Francisco. In 2018, you had, the police estimated to have maybe 300 to 400 drug dealers, like we talked about. Now there's 1,000. And the biggest factor, there's two big factors. One, they used to be able to kind of contain this problem in one neighborhood in the Tenderloin district, which is right next to downtown San Francisco. But the problem's gotten so big that it's spilled into other communities, other neighborhoods now in San Francisco. And so that's why people are kind of up in arms, because you kind of expected the Tenderloin has struggled for many, many years with poverty and crime and drugs. But now it's spilled into adjacent neighborhoods, and it's really destabilizing those neighborhoods, because now you just go out for a coffee and you've got someone lying there potentially dead on the street that you're literally stepping over to go get your coffee. And there's needles all over the street and foil and straws from people smoking their drugs. And it's just not a good look for San Francisco. And our policy, again, has been very slow to respond, because we've taken this kind of radical harm reduction approach where it's hands off everything. Nobody's going to intervene. We're going to just let people, be out there using drugs in front of children, and everything seems to be okay. Well, guess what? It's not okay. San Francisco has received international scrutiny for their handling of this problem, and it's harmed its economy. We're last on the list of cities to recover from the pandemic. And this is the reason why: homelessness and drug addiction.
Local San Francisco resident JJ Smith spends his days talking to and filming addicts as a citizen journalist. As confronting and shocking as JJ's social media posts may be, he wants the world to know exactly how fentanyl has affected his city.
Fentanyl is the main drug now because it's cheaper and it's more accessible. Like, you can get a hit of fentanyl for $4, $5, and it's easy for a person to panhandle or steal something to make that $4 or $5 just to get a hit. And they use that periodically all during the day.
And the crisis taking place in the city's downtown streets is in plain sight.
Just out in the open, don't nobody hide it anymore. It's not like people used to go sit in the alley where nobody can see them, or they'll put it down where nobody can see them. They don't care if they see you. They just use it in the open all day. I've seen 18-year-old kids out here, 17-year-old kids, such as I have this young kid named Noah. He's been using drugs since he was 13 years old. And he's 18 now, and he done overdosed like 3 times already. And it seems as though he don't want to change his behavior. And it just hurts me bad to see someone that young hooked on serious drugs such as fentanyl.
Last week, San Francisco hosted world leaders, including China's leader Xi Jinping, to the APEC summit. In order to play host, California Governor Gavin Newsom and San Francisco Mayor London Breed created the facade that the city wasn't inundated by a drug and homelessness crisis by having a quick sweep of the city.
And for that week, we kind of had a respite here in downtown San Francisco, where the streets were clear. They moved the homeless out of the downtown area and pushed them up into other neighborhoods. And so for 1 week, those streets, Market Street, our main street in San Francisco, was clean. It was great. And it's because there was a massive police presence here. Now that APEC has ended, the situation is pretty much returned back to the way it was before.
I know folks say, oh, they're just cleaning up this place because all those fancy leaders are coming into town. That's true, because it's true. But it's also true for months and months and months prior to APEC, we've been having different conversations.
Well, Tom, Gavin Newsom admitted to the fact that he did implement all those changes ahead of APEC, ahead of all these world leaders coming into town, coming to San Francisco. He wants to show off the city that he was the mayor of. And then it goes back to normal. I read this tweet from comedian Bill Maher, and he said it was kind of like erasing all your data on your computer ahead of letting someone look at your laptop. Is that the kind of situation that San Francisco has seen? You've got the governor of California wanting to show off, get rid of all the homeless, get rid of all the drug addicts on the streets so that these big world leaders can drive through and think it's all fine and dandy when it's absolutely not.
That's pretty much what happened, except they didn't get rid of anybody. It's not like anybody got housed. It's not like anybody went to drug treatment. They just shuffled them around into different neighborhoods to clear out the downtown area. And then they built fences. They put up fences all around the downtown area where the APEC members were attending events to secure those areas. So it's just kind of funny how they talk about, they jump all over like President Trump as an example for not, trying to build the wall, but then here they are building walls in San Francisco, the most liberal city in maybe North America, at least the United States, to actually secure areas to keep homeless and drug users and drug dealers away. It's kind of hypocritical, but it also does show that with the right political will and the right motivation and enough resources, San Francisco can respond and it can improve its street conditions.
Well, that's exactly right, Tom. It was shown that the government can actually do something about it if they put the effort, the resources into it. So why is there no permanent solution to this massive conflict, this massive issue that is happening?
Lots of different reasons. A lot of it has to do with policy. The state has changed a lot of different laws around criminality in California so that quality of life crimes have been, the penalties for them have been greatly reduced. Some of it has to do with resources. There isn't enough housing. There's no drug treatment in San Francisco. San Francisco has 22,000 drug users and about 500 drug treatment beds for the entire city and only 57 detox beds for all of San Francisco. So there just isn't a lot of places for people to go. And at the same time, the cartel has taken a foothold in San Francisco. We estimate to have somewhere between 800 to 1,000 organized drug dealers dealing in broad daylight in San Francisco right now, and they're all selling fentanyl. And because there's so much of it, the price has dropped to as little as $5 for a tenth of a gram. And that's enough to kill 5 or 6 people just right there.
Well, Tom, is it safe to say that Democrats have ruined the city by they're not tough enough on crime, they're not investing enough in resources on the street? They were kind of like, the mayor wanted to defund the police for a little bit and now has, backtracked on that. Are they not taking this situation seriously enough, especially after the pandemic?
Well, my friend Michael Schellenberger wrote a book a couple of years ago called San Francisco, Why Progressives Ruin Cities. And there's a reason why I was in that book. He's not wrong. So there's Democrats and then there's progressive Democrats. And I consider myself a Democrat, but a kind of a middle of the road Democrat. But the progressives, with this kind of radical interpretation of their harm reduction and decriminalization, have done great harm to San Francisco. And, it's time for San Francisco to pivot back towards the center and embrace the idea of public safety as part of its overall policy for San Francisco. If you want to be progressive, go ahead. I don't care. Knock yourself out. But progressive policy never works without public safety, and that's what we're seeing play out right now in San Francisco.
What do you think the overall answer would be to fixing this fentanyl crisis and this homelessness crisis in San Francisco, and I guess in the broader spectrum of things? How do we stop fentanyl from seeping into every corner of the globe?
Well, so it's a multifaceted thing. You have to reduce demand, which is true. So that's where your public health approaches come in and can be helpful. But you need to reduce the supply. Let's face it. Just in San Francisco alone, a small city, has over 200 pounds of fentanyl has been seized in a 6-month period, which is more than double the amount of all of last year and more than 4 times the amount from the year before. So when you think about the actual quantity of fentanyl flowing across our border and our seemingly inability to stop it, it's creating this crisis where we're way behind in addressing. And you've got all these folks on the left that are screaming for decriminalization and that law enforcement isn't a solution. They point to data from the 1990s, which was a totally different era and a different drug, to argue as to why we shouldn't enforce or arrest drug dealers. And I'm sitting here like screaming from the rooftops, telling people that the drug market has changed. We have a cartel-fueled network of drug dealers all up and down the west coast of the United States selling drugs. And the drug that they're selling in San Francisco is killing 3 people a day. And in Los Angeles, it's killing 7 people a day. And we can't just stand by and say, oh, well, we're just going to try to urge people to go to drug treatment when they're ready. No, we need to step in and say, enough. We want to save lives. We're going to do what we can to stop the fentanyl from coming into our communities while deeply investing in drug treatment and transitional housing and shelter to get people off the street and on the road to recovery.
Tom, just finally, when you're walking through the streets and you're doing your kind of research, going to meet these people that are living on the streets and addicted to drugs, do you get the idea that there is a need to want to be rehabilitated, to want the help?
Yeah, that's a great question. So the way I'll answer that is that people on the street want 2 primary things. 1, they do want to get off the street. And 2, they do eventually want to get off of drugs, but they want to do those things on their own terms. They don't want anyone telling them what to do. And usually when someone tells you that's using drugs, yeah, I do want to get off drugs, the majority of the time that means not today, not right now. It means at some point down the road. So it's okay, I think, to give people a little nudge or a little push in that direction. That's what I needed to find recovery. I understand that doesn't work for everyone, but look, when you're homeless on the street and you've fallen all the way down to that point where you're sleeping in a tent on the street, smoking or injecting fentanyl every 2 hours just to survive, I think at that point, we as a community need to step in and say enough for the sake of our own community, not just to save that person's life, but to save our entire community. Because right now, San Francisco is really falling apart, and the contrast that you saw from APEC to now just added fuel to that fire, because again, it showed everyone that we can do this if we really want to and commit the resources to it, but we're just maybe choosing not to. And that's when you have to start looking at our leadership in San Francisco and asking, what are they doing? Are they doing enough? The answer is no, they're clearly not doing enough. And we just have to kind of go from there, which is why I encourage people to, pay attention to what's happening in San Francisco, because what's happening here is coming. It's spreading across the United States. It's in Canada. And, God forbid the day that fentanyl arrives at the shores of the United Kingdom. I'm sincerely concerned, because the policies that you have in place right now, the policies that we had in place previously, we were not prepared for this. And look at what has happened now.